Hello again. I'm trying to analyze the incidence of dementia, and we have been talking about various contributing factors to dementia. If you have watched my previous YouTube videos, we talked about genetics, we talked about vitamin D, we talked about exercise, we talked about cognitive function. These are all related to the dementia and Alzheimer's disease. Now, the two are separate, but a dementia develops in many people who get older. And of course, the vascular dementia, which means the circulation or the small blood vessels going to the brain, don't do that well. And you develop the dementia because you lose the cerebral or the brain cells. So the vascular dementia is common. The Alzheimer's is a special one, which is related to either amyloid deposition or tau protein. And we talked about its relationship with various stuff, including flashing LED lights, to vitamin D, to exercise, and also to many other factors. I came across an article, and this is why I'm talking today about dementia or diagnosis of dementia along with depression. So this was a very interesting study that I came across, and it kind of intrigued me because recently with COVID and the COVID pandemic, people have been isolated, especially if you remember in nursing homes, people were not allowed to visit their relatives because of the fear of bringing in COVID disease in the elderly people in the nursing home. And so many times, many of these elderly people lived alone and were not mixing with anybody. Their relatives didn't come, and this could have happened for anywhere from 6 months to a year. This isolation certainly increased the rate of dementia. The same thing happened even with younger people who were going to the colleges or schools and were isolated because everybody was doing a non-school classroom attended Zoom meetings and education on computer rather than mixing with people, having social contacts, and developing those kind of skills, but at the same time. And these people also have more incidences of depression. So the study that I'm quoting today is related to the adults. It's a very interesting study. The study shows that this was done from Danish cohort study. A very interesting study to me because the study was a large population of people that were diagnosed with depression based on their diagnosis in the medical records and diagnosis of dementia, again mentioned in their medical records. No patient was actually contacted or their symptoms were asked. They did exclude a lot of people, those people who were diagnosed with chronic lung disease, cardiac issues, and many others. Bad diagnoses were excluded. And these people were followed for a long time. The interesting thing was that the patients were not actually seen or followed, but they were age and sex matched based on the birth date. So the number of patients that they analyzed was 1.4 million, which is fairly large. Of this, they were analyzed between year 2020 to 2023, and the whole thing was from 1977 to 2018. So I think it's a fairly large group. Again, before I go to the end of the talk, the drawback is that no patient actually was interviewed, and the diagnosis of depression or dementia was purely based on their medical records. So there were 246,499 patients who were between ages of 50 and 70 that were analyzed. The comparable matching group was almost 1.2 million. Actually, it was 1.190,322 patients. So it's pretty fairly large. And the total was 1.4 million. Two-thirds of the patients were less than 60 and diagnosed with dementia, diagnosed with rather depression. So it was very interesting that those people who were diagnosed with depression had 2.4 times higher, or HR as it is called, hazard ratio of developing dementia when they were followed. Now, like any other disease, if we talk about coronary artery disease, for example, and diabetes, longer the duration of diabetes, higher the risk of developing coronary artery disease. Longer the duration of hypertension, higher the risk of developing coronary artery disease. Same way, when they followed these people from early life, middle life, or late life, all three groups had a higher diagnosis of dementia. The hazard ratio, which means possibility of developing a diagnosis with the follow-up, was much higher. That's the HR or hazard ratio. So for example, when you took the younger population when they were diagnosed with depression, these population was younger than like 18 to 39, 18 to 44. They had a hazard ratio of 3.08, which is high, 3 times risk of developing dementia when the diagnosis of depression was done at an earlier age, less than 44. When the diagnosis of depression was done between ages of 45 to 59, the hazard ratio was 2.95, the less than when they were diagnosed at earlier age, but still substantial. That means comparative age group had a less chance. These people were almost 3 times the risk of developing dementia at a later age. When they talked about the late life, or people who were greater than 60 years of age when the diagnosis of depression was done, they had a hazard ratio of 2.31, which is again substantial, almost 2 times, more than 2 times the chance of developing dementia when they were diagnosed with depression when the age group was less than 60, rather more than 60. So in all 3 age groups, whether they were younger than 45 or younger than 60 or older than 60, all 3 age groups had a high risk of developing dementia when the diagnosis of depression was done. If the diagnosis of depression was done at an earlier age, you had a higher chance of developing dementia than it was done at a later age. But still, at all age groups, the diagnosis of dementia was present at a higher percentage when the diagnosis of depression was there. And these were comparable, age and sex comparable, and major diseases were excluded that could contribute to such a existence. The interesting part was, why did this occur? And there is no real clear-cut explanation. The drawback of the study was that these people only reviewed the medical records for the diagnosis of dementia as well as depression. There are 2 possibilities that exist as to why would somebody have depression diagnosed and later life develop dementia. One is that the depression does cause a decrease in physical activity as well as mixing or social life. Those people who are depressed have a less social life, they have less mixing with the other people, and they have a less physical activity. So social contacts have been known to contribute to the dementia. In fact, there was a study which showed that when the social contact was improved in elderly people, their scores on dementia was improved. The second possibility, so certainly a lack of social contact and decrease in physical activity with depression diagnosis can increase the risk of dementia. Second possibility is some kind of neurotransmitters that may be associated with depression which also contribute to development of dementia. Now, we do not have any such neurochemical or neurotransmitter known, so that remains to be seen or researched. But certainly, if somebody is diagnosed with depression at an earlier age, he is at high risk. Even at a later age, he is at a higher risk, but not as high as if the depression was diagnosed at a very early age. Thank you for watching. If you like it, please subscribe. Have a nice day.